Hello, everybody. We're about town once again, and this time I'm visiting with Highland County Health Commissioner Jared Warner. Jared, it's been a while since we've gotten together.
It's been a little bit. How you doing?
I am doing fine. I'm doing fine. Spring's on its way. How could you be otherwise?
That's right.
A lot of things happening at the health department. Why don't you share that with me? I know you've got a levy coming up here in the not too distant future.
We do. So we tried to pass a levy in November, and weren't able to get it passed. So we've got another levy coming up, and a chance to pass it on May the 6th, 2025.
Right.
And we've further reduced how much we're looking to get that levy passed for. So right now we're looking at 0.5 mils, which to put that in dollars and cents, because no one really knows what a mil is.
Yeah.
It's about $1.50 per month per $100,000 property.
Okay.
Or another way to look at it is about $17.50 a year for every $100,000 in property value. If anyone's interested in seeing more about what their property taxes go towards, I always like to send them to Alex Butler's auditor's website, because he puts together a little pie chart, and it shows you how much a slice of each type of property tax goes to where.
Right.
And of course, most of it ends up going to the schools. And if you look at that chart, the health department is right at the very top, and it's for most people about 1% of their overall tax bill.
I see.
So it's a very, very small portion of taxes that we're looking to.
Well, now tell me, why should I care? Why should I care about a levy for the health department? Tell me what you do.
Sure, and that's a question we actually get a lot. And when I was young and first looking for jobs in the area, I saw a job opening for Highland County Health Department, and I thought, I'm not sure I knew we had a health department at that point in my life. And so ever since then, I've been really amazed to see all the different programs and different ways that we get involved and support the community in being healthy. So some of the big programs that most people do know about is food inspections.
Right.
So we go out to every restaurant, every grocery store, every gas station, every mobile food truck, and we make sure they're keeping cold foods cold, hot foods hot. They're washing their hands, and then if people have complaints or concerns, and they call us, we go out and check on those as well.
Sure.
So we do over 700 food inspections a year. We also work a lot with communicable disease, trying to prevent disease through vaccination programs. We also talk to a lot of people who get diagnosed with communicable diseases. So let's say someone contracts a disease that it has the potential to pass from person to person. We get reports of those diseases, and we often reach out to those individuals, and we explain to them, hey, you've been diagnosed with this disease. Do you understand how it works? And here's how you can keep it from spreading within your household.
Right.
So doing that kind of stuff, person to person, and working with our local healthcare partners and helping them have those same conversations person to person really helps to reduce the number of diseases and the cases that occur in Highland County. So we've got programs like that a lot of people are aware of. And we have other things that are a little newer, like our free dumpster days that we do. This will be the third year that we're going to be doing some free dumpster days, where we just open up dumpsters in different parts of the community and try to encourage people, instead of throwing your old couch in the backyard and letting it sit there for 5 years, bring it in here and throw it out.
Now, you do that a number of times throughout the year. When's the first this year?
Oh, I think it's coming up in April or May. I have to check and be sure when the first one is.
Okay.
Last year we pulled out over 43 tons of trash from Highland County.
Yes, right.
So it was a really successful year for us.
Where do you take that?
We've got partnerships. It depends on who we've hired as a contractor. Last year we used Rumpke. I think we've got a different vendor this year, so we bid it out to see who's got the best prices.
I see.
So I think we're doing something different this year. So,
and a lot of people don't realize that you live out in the county and you're building a house, or you're going to change out your septic system. The health department's called.
Yeah. So the state of Ohio requires septic systems to get installed to meet certain guidelines or certain requirements, and part of our job is to help homeowners navigate that process. If you've ever built a house and worked in septic,
yes,
it can be complicated.
Yeah,
we got the question. Actually, I saw it on social media a couple weeks ago. the question about how much land do I need for a septic system? And the answer is it depends. How big is your house? What's the land look like? What's the soil like? There's a lot of factors that go into it.
Sure.
So we've got environmental technicians here who know those programs inside and out and help people navigate that so they can put things in.
Right.
All told, we've got over 60 different programs that we offer to the community.
Well, we're talking about the health department. There's been, and we're especially sensitive to this since COVID, but it seems there's an outbreak of measles. Has that come as far as Highland County?
Not yet. There's so last I checked, actually just was reading a report this morning from CDC. There were 10 states involved and somewhere around 233 individual cases of measles that have been identified. Most of those are in Texas and New Mexico. The nearest case to us was in Kentucky.
Right.
And so we do look at that, and we're concerned about measles because it's, if you really get into the weeds on how the diseases work and how they spread, measles is the most contagious disease that we actually know of.
Really?
So if you have a person who has measles and gets in a room of people that are not vaccinated and susceptible to measles,
right,
it's something like 18 out of 20 will get it, or it's just off the charts.
So are there a lot of people who are not getting vaccinated for that? I hate to bring up that controversial topic.
It can be controversial. Sometimes I don't know why it is, but we really try to take an educational approach to it.
Right.
If people have questions, we're trying to provide good information. They can make their own decisions. But one of the things that people often forget is that some people decide not to get vaccinated for personal reasons or for religious reasons or philosophical reasons or whatever. But there's a whole other group of people who would love to get vaccinated and can't because they've got autoimmune disorders or other physical conditions that keep them from being protected. And so that group is really at risk when we have our overall vaccination rates drop, like we're seeing right now, kind of across the board in the United States. So, and it's interesting to bring that up because in November we did an exercise with Highland District Hospital, and it was all about what do we do locally in our hospital if we have a measles case that shows up in the emergency room or that shows up and gets admitted to the floor. How do they work on internally controlling infection control at the hospital? How do we do disease tracking in the community? We had partners from Highland Health Providers there, from Highland County EMA there, and so we walked through the whole process of if it lands here, what are we going to do with it? So,
right.
And I think that was a little bit before Texas kind of exploded with their outbreak. So measles was on.
So somebody somewhere saw this coming.
We've been watching it for a few years. Outbreaks here and there. There's enough people vaccinated locally that we're not going to see thousands of cases in Highland County, but the chance that we could see dozens, 50, 100, that really kind of depends on where our vaccination rates sit and who all is susceptible.
We went for years and years and years, and you didn't see it that much. I remember having it as a kid.
Oh yeah,
I had measles as a kid. That might have been what made me the man I am today, which you want to be vaccinated for that, boys and girls.
Yeah.
But, I think the science and the track record kind of proves the science out, that the vaccination kept it from being a continuing, outbreak.
Sure. Yeah, and I'm not a medical doctor, so I can only kind of go by.
I play one on TV. That's all.
That's sometimes how I feel too. So we have a great medical director who would go in a lot of the ins and outs on it. But yeah, we've got a good solution for measles. And one of the interesting things with measles is if our overall community vaccination rate drops below like 95% or so, that's where you could see something like a Texas event happen, where you have a small pocket of almost exclusively unvaccinated people who are going to get it, and then they can spread it amongst themselves. Occasionally, you will get someone who's vaccinated that gets it, but that's almost definitely an exception.
Do you think that as a result of everything surrounding the COVID pandemic and the vaccinations and so on and so forth might be the reason that now we have a new generation of people who are opposed to vaccinations, period. So you may see the numbers drop. Anything to that?
So I think that COVID was, I know we talked several times during COVID.
Yes, we did.
COVID was an interesting
As a matter of fact, we talked about it so much I got it. So,
COVID was a very interesting time for public health. And one of the things that, I'm sure my phone also doesn't buzz on.
Sure.
One of the things that I think hurt us in COVID is we didn't get everything right. There were quite a few things that, in hindsight, that didn't work out very well.
Well, we've never had it before.
And you do that in any emergency. You can always Monday morning quarterback it and say, oh, that didn't work and this didn't work. But there are some things that I think the science shows and the data shows were very effective, and vaccination is one of them.
Mm-hmm.
I do think that there's a general sentiment, anti-vaccine sentiment that we're going to see growing.
Yeah.
And it makes our communities a little higher risk, and it also especially makes those groups of people who would love to get vaccinated and can't get vaccinated,
Right.
It puts them at higher risk. So
Yeah.
it is something to be concerned about. In a lot of cases, it's because we've not seen these diseases, so we're more concerned about the cure than we are the disease that started the issues in the first place.
Well, it'll be interesting to see how that plays out further down the road, and hopefully we won't see outbreaks like we did with COVID or anything like that. There was one reason in particular I wanted to get together with you. You have a blood drive that is coming. It's coming up this weekend, isn't it?
Yeah, it's coming up real soon on March 16th. We're going to
16th.
have Hawksworth and doing a blood drive here, and this is probably about the 5th or 6th time we've invited him down.
Right.
And I've been really pleasantly surprised by how many people have showed up and donated.
Yeah.
We've had a couple of times where we filled the appointments, which was really exciting.
Yeah.
I don't think Hawksworth expected that from our community. So they'll be in on the 16th, and we've got other opportunities throughout the year to do that. And that's one of the things that we really have focused on in 2024, and we're going to continue to focus on in 2025, is finding some partnerships like that where we can bring in healthcare partners and do good things for the community.
Sure.
Last year we brought in Health Source for free vision screenings, and so we ended up, I think we saw 9 kids, and 5 of them needed glasses, so we were able to connect them to glasses and getting them some support.
Sure.
Then we had a dentist come in through Health Source, and we found 22 cavities out of, thinking it was 30-some kids.
Yeah.
So finding ways like that to bring services in, because we all know there's limited number of healthcare providers in the community, and the more we can remove barriers and get people access to those services, the better we're going to be off, as a community in our health. So we really try to find ways to bring those partners in.
Is the need about the same as it has been over the past few years, or is there a growing need for blood?
I'm not an expert on that, so I'd have to ask the Hawksworth people.
Okay, I didn't know if they
lines. There was a time
provide
where it was real low, so I'm not sure where things are currently.
But as you go back to the topic before, and forgive me for chasing rabbits, there is a great health need that goes overlooked, and so it's good that you're able to do these types of things. And I think what would be good is when you're having them, let us know in advance. We'll be out. We'll run our cameras and we'll talk with some people and just and give credit where credit's due, and just see what networking from having been involved with, like the Highland County Society for Children and Adults. Networking is everything.
Yeah.
You may not offer this, but someone else may offer this, and so it's just a great thing.
Yeah, and for anyone watching the video here, we've got this up on our website. It's a calendar for all the events that we do throughout the year, and every month we've got a different focus for specific health screenings or areas that we're trying to encourage people to pay attention to. Highland County, so I always bring up the cancer rates in the county.
Yeah.
One of the things that I find really interesting and really sometimes discouraging is that our cancer rates across the county tend to be pretty consistent with the rest of the state.
Right.
The number of cancer cases that occur. But when you look at the number of people in Highland County who die from cancer, we're much higher than the state average. And the big reason for that is that we don't take advantage of preventative screenings. People don't get in to see their doctor on a regular basis. They don't get those preventative health screenings. And sometimes it's a cost issue. Sometimes it's transportation. They don't have a car to get there. So the more that we can remove those barriers and connect people directly to the services, the earlier we find problems and the healthier people are in the long run. So that's a big focus of public health and of the health department in general, is trying to connect people to services and remove those barriers.
Right. Well, we'll be talking more about that as time comes. And certainly as any need arises, you be sure and keep me posted on that, all right?
Sure.
All right. Jared Warner, thank you so much, brother. It's good to see you again.
Good to see you too.
Yeah, we'll do this a lot more often. We want to thank you so much for visiting with us on About Town.